What is the average time for a Medicare appeal decision? Imagine waiting for a decision that could change your healthcare coverage or payments. How long does it really take to get an answer when you challenge a Medicare decision? Well, the answer depends on where you are in the appeals process. Medicare has a few steps, each with its own timeline. Knowing these can help you plan and stay patient. The first step is called redetermination. This is your initial formal appeal. You need to file within 120 days after you get the original decision. A Medicare administrative contractor, who was not involved in the first decision, reviews your case. They usually make a decision within 60 days of receiving your request. If you disagree with this decision, you can move to the next step. The second step is reconsideration. You have 180 days from the redetermination notice to ask for this review. A qualified independent contractor, or QAC, looks at your case. They generally decide within 60 days of getting your request. If you still disagree, you can request a hearing with an administrative law judge. This third step is where things used to take a long time. Waiting times for a hearing used to stretch to nearly 4 years. But now, thanks to improvements, the average wait time is about 71 days from when you request the hearing. The law says the administrative law judge must decide within 90 days of receiving your request, but sometimes it can take a little longer. If you do not agree with the administrative law judge's decision, you can appeal to the Medicare Appeals Council. You have 60 days to file this appeal. There is no fixed deadline for the council to decide, so wait times can vary. The final step is judicial review. You can take your case to federal court if the amount in dispute is high enough. Court deadlines and processing times vary depending on the case. Most appeals at the first 2 levels are finished within about 60 days each. The administrative law judge hearing now takes around 71 days on average. This is a big improvement from past years when delays were much longer. For urgent cases like hospital discharges, there are special rules. You can request an expedited review by a quality improvement organization. They must decide within 24 hours for these cases. In general, the total time for a Medicare appeal can be from a few days for urgent hospital cases to several months for more complex disputes. Most standard appeals are resolved within a few months if there are no unusual delays. Knowing these timelines helps you stay prepared and understand what to expect. If you are in the hospital and facing discharge, act quickly to use the fast-track process. For other issues, follow each step carefully and meet all deadlines. Keep copies of your paperwork and note dates to track your appeal. This way, you can stay on top of the process and get the decision you need.